Hey, what's going on? This is JJ Singh coming at you with a response to the Obama speech and Q&A in Colorado, as well as a response to the Fox News report immediately after the Q&A session. Overall, yeah, there was a lot of repetition in what Obama said versus what I've heard in the past. The questions, there was one kid that was going to school there that definitely had a heated comment. Another gentleman that was working for health insurance that was, anti-reform, and a couple really good questions, a couple kind of stupid questions, one completely pointless question, and even one poor guy who started to say something but got cut off and never really got his question answered. No, probably for the best, because he was just going to talk trash about cable news that he may feel is skewed, which really wasn't beneficial for the meeting or the Q&A. Overall, though, if you've been following healthcare reform and the bill and the debates, not very informative, nothing new. If you've already been following it, and this one's your first. If it was your first, I think it probably did. Could have helped a person. Some of the notes I made, as far as especially the speech, is when President Obama mentioned ban on arbitrary caps on premiums, that no one should go broke because they get sick. Talking about how insurance can cut coverage because of getting sick or denying coverage because of pre-existing conditions. And he wants one. And what people have to understand about the healthcare reform is that it's not just focused on insurance companies. It's also focused on the delivery system, which he said a couple times, and the requirements by current insurance companies, and what in the bill is called Quality Health Benefits Plan. And he's mentioned a few times about setting up a healthcare exchange, and the participating insurance companies having to meet the standards of this quality health insurance plan. The plan is not just for the public option, but also for those private options that want to be included in the exchange. And that's something that he's not mentioning. Yeah, he's mentioning that there's this health insurance exchange which all health insurance companies can be a part of, and that's not true. Now, at least according to the version of the HR 32 that I've been reading, members of the health insurance exchange have to meet certain criteria and certain standards, especially in terms of the essential benefits package put together by this Health Benefits Advisory Committee, which is chaired by the Surgeon General. And what all that means is the Surgeon General with this Health Advisory Committee is going to set up standards for what they expect the public option insurance company to live up to, and any other private insurance company that wants to join the health insurance exchange, which they don't have to. So it's not a blanket thing. There's choice involved, and we know how much Americans love choice and how much Americans don't want to offer choice and keep things the same. But those insurance companies that will be a part of the Quality Health Benefits Plan are mandated to provide certain coverage, to eliminate pre-existing conditions, and to make sure that private insurance, the insured, aren't SOL whenever insurance companies want to change their coverage. And there's all types of mandates in the bill that prevent that from happening, and changing, and yes, making changes to private insurances, and even those that want to be included in the Quality Health Benefits Plan or the insurance exchange. He also mentioned something that his plan and his desire is that he doesn't want any insurance companies messing with our care or government bureaucrats, because the argument is, why should we trust the government to take care of our insurance? Well, we're already trusting the government with Medicaid and Medicare, really, at least to some extent. No one's screaming from the rooftops to abandon Medicare. something that Mike Huckabee mentioned is how FEMA failed, and I appreciate that Mike Huckabee said this and pointed out how FEMA failed to provide water and services for so many days when Katrina hit New Orleans. And there's show time and time again, government just doesn't respond. The government agencies don't respond in what most Americans view as a timely fashion. And so the question is, why would I want government messing with my health care? And the point that he made, that I think something I agree with, is that he doesn't want government bureaucrats messing with your healthcare, just like he doesn't want insurance companies and their bureaucrats messing with your health coverage too. And I understand the vast majority of Americans want health care reform, just not necessarily what Obama's proposing, what's in HR 3200. But what we all agree on was we don't, and I think that probably the most opposed to any healthcare reform are those that honestly don't really need healthcare, or those that really haven't had a need for they're healthy, their kids are healthy, and healthcare and health insurance companies love you the most because you pay your premiums, you just don't really cost anything because they don't have to reimburse their any providers for your services because you don't use them. But he wants to help make insurance more affordable and more secure. He wants a healthcare tax credit on the new market, in the new market, with health insurance options and smart incentives. Something he mentioned this time and last time is something especially that I really liked, is